I can't believe it's David's first birthday already. I remember going into labor. Some of us were pretty excited. But Mark was totally in control. Right. We managed to make it to Kapiolani in one piece. I was pre-registered, so we went straight to the family birth center. They got us all calmed down and took us to our beautiful labor, delivery, and recovery suite. This was our choice because Kapiolani was the right choice for our baby.
The labor delivery room suites are very home-like. Enough space for patients to bring in their own family if they want to share their experience with them. At the same time, the rooms are well equipped with state-of-the-art equipment that if an unforeseen event should happen, that everything's there to make sure that the outcome of the pregnancy goes well. All the family birth center rooms have nice big windows which will allow light to come in, which allows it to give a nice, beautiful environment to have your baby.
They made me feel comfortable. It wasn't long before Mom, Dad, and Nicole arrived. Having the family around meant a lot to me. The labor was long, but went really well. The childbirth classes were a big help. With all our preparation and everyone working together, David's birth was as smooth as it could be. The first day is one you never forget. Every time they bring you the baby, you're thinking, what a miracle this all is.
Having a baby is definitely an experience of your lifetime. So we want to make it a comfortable and safe environment for you, and one that you truly will be able to enjoy with that baby and your partner and your family if you choose to have them in there. And after the delivery, we want to give them an opportunity to bond with that baby, to take pictures, do what they would like to do. If the mom is choosing to breastfeed, we want to give her and that baby an opportunity to get breastfeeding started off on the right foot and allow them time to do that. Or just simply skin-to-skin contact with the baby and have that experience to enjoy. So we really rely too on the family deciding what it is that they want to have at their birth experience as far as family is concerned, within, again, the confines of making it a safe and comfortable experience for them.
Well, following the birth of a child, parents and infant are transferred to our 4th floor to Mother-Baby Care Unit. These are all private rooms upstairs that allow the opportunity for parents to bond with their infant and bond as a family following delivery. In labor and delivery areas, you need significantly more medical equipment to facilitate a delivery. There's infant equipment as well as supplies for the mother that are involved. So in the mother-baby care area, the lack of necessity for that equipment allows the family to be in a cozier environment that allows them to bond with their babies.
There was so much attention to little details like the celebration for two. What a romantic touch. We really valued that time together.
The celebration meal is a meal that's very special that we provide to new moms and their guests to celebrate the birth of their child.
They treated us so well. Kapiolani was definitely the right choice for our baby.
It's the only women's and children's hospital in the state of Hawaii. So we get transports from literally all over the world for mothers who are having complications during their pregnancy. So because the focus at this hospital is primarily just on women's care and children's care, we have a lot of the expertise that's required to take care of the complications you see in pregnancy, as well as, of course, the normal pregnancies.
David's been so healthy, and he's growing so fast. But what I want to know is, where did that blonde hair come from?
Childhood and parenthood, are full of important first steps. But perhaps the most important one is deciding where you will have your baby. Your baby deserves to be in the hands of people who have cared for more babies than any other hospital in the state of Hawaii. A place where your whole family can be part of the beautiful birth experience. The medical center other hospitals depend on in emergencies. Kapiolani Medical Center for Women and Children. It's the right choice for your baby.
In 1890, Queen Kapiolani established the maternity hospital for the women and children because she was so concerned about the health and the well-being of the women and newborns in particular in Hawaii. She was a public health advocate, and she wanted to make sure the women of Hawaii had the services they needed to have safe and quality care. And we've continued that mission. Our mission here at Women's and Children's is to advocate for the health and well-being of the women and children of Hawaii. And for many generations and throughout the years, through research, through education, and through our clinical programs, we have continued on that mission and stayed focused on that mission to provide those services, not just to Hawaii, but to the Pacific Rim as well.
How good is Kapiolani? Kapiolani is the tertiary care center for women and children in Hawaii. It is the only children's hospital in the state and the only facility specializing in the care of newborn babies.
Kapiolani Medical Center is the women and children's hospital for Hawaii, and it is, in addition to that, the tertiary referral center for the state of Hawaii and the Pacific Basin. Given that allows Kapiolani to provide wonderful mother-baby care for routine deliveries throughout the state of Hawaii, but we also provide, I think, a very important specialized care for any high-risk babies or any high-risk pregnancies for the mothers, the babies, and the obstetricians that deliver here.
Advanced life support is one hallmark of tertiary care facilities. So having ventilators or breathing machines, having continuous monitoring, and being able to provide services to complex patient care would be certainly features for tertiary care facility.
It takes an extraordinary array of medical resources to be the tertiary care center. As Hawaii's only children's hospital, Kapiolani's neonatologists are on site 24 hours a day to ensure every baby can receive immediate care at delivery should the need arise. No other hospital provides this level of care for newborns.
A neonatologist is a specialized pediatrician. Pediatricians go through a 3-year training after they finish medical school. A neonatologist goes through a further 3-year of training, taking care of sick newborn babies.
As a neonatologist, we are here to take care of babies that are sick or not doing well. That's our fundamental job. So if we're called to a delivery, the reason we're called is because there's a concern for the baby. And it could be one of 3 things primarily. A routine delivery that the baby comes out and just isn't doing well for reasons we're not clear of. The second one is if the obstetricians are concerned that the baby may not be doing well based on how the labor is going, or we just know the baby's going to need our care when they come out, such as a premature delivery. We're part of what's called a rapid response team. And the rapid response team is there 24 hours a day, 7 days a week to be available for these babies at a minute's notice. And it's a big team. We don't go in there alone. We go in with a nurse practitioner. If not a nurse practitioner, we'll have pediatric neonatology hospitalists that are trained to help us in the neonatal unit. There are NICU nurses that are involved with this team and respiratory therapy. And we often have pediatric residents that are there with us. So it's a large team, can be 5 or 6 people that are there for that one baby to manage them in those critical moments of early life.
Kapiolani also has a group of maternal fetal medicine physicians to help and assist and to make the right decisions about the delivery.
Maternal fetal medicine specialist is someone who takes care of women with high-risk pregnancies. It's also been called in the past a perinatologist, but we deal not only with mothers' medical problems like high blood pressure, diabetes, heart disease, lupus, or other medical conditions, but we also diagnose and take care of mothers who are carrying pregnancies where there's something wrong with the fetus, whether it be a birth defect or a genetic problem, multiple pregnancy like twins or triplets. So it kind of runs the gamut.
One of the things we do is genetic counseling and genetic evaluations. We can help you make your pregnancy go as well as it can through visits, tests, and consultation.
So I would have to say that the physicians here and the nursing here set the standard for the state, and that we're very much on par, if not above par, for the standards for the nation as well.
I think one of the strongest points about Kapiolani Medical Center for Women and Children is that it has a 24-hour coverage for anesthesia and for pediatrics. With the 24-hour coverage with the anesthesia, women in labor can get pain management throughout the day and night when they're laboring.
We not only provide the complete care 24 hours a day, 7 days a week for every baby born in this hospital if they do need our care, but it's also a complete care hospital for the mothers as well. So this is a place that provides 24 hours a day, 7 days a week, rapid response for babies that are high risk or born with difficulty, but also offers wonderful facilities for just routine deliveries for all the mothers and babies. And on top of it, it's a complete women's healthcare facility as well. I think that makes it not only unique in the islands, but I think it makes it very unique across the United States as well.
The philosophy of the birth center is that we consider the delivery of a child to be a milestone in your life. So we really encourage patients, if they have concerns about their care, any questions related to the unit, we encourage them to address those questions with staff, with the charge nurse or the manager as well. We really want this to be a very positive experience for our patients because it is a milestone in their life.
That night at 11 o'clock p.m., my water broke. My auntie had to bring me to the hospital, so they were expecting me, you know. They were so reassuring that, oh, you're fine, you'll be okay. They took me upstairs, and as soon as I got in there, my nurse came in right away, and she was just this big, tall lady, and she was so nice, you know, like she asked me a lot of questions, like, you know, how are you feeling? How's your pain? And it was nice to know that she was there and very supportive and could help me with whatever I needed. I don't think there was a limit to how many people I could have in my birthing room. My mom, my grandma, my mother-in-law, and they really do encourage the family to have a part in it, you know. I ended up giving birth at 5:37 p.m. on January 31st. Because of the experience that I have had at Kapiolani, I know that's the best. I always stress the fact that, like, I was emotionally and mentally and just prepared, you know, and that was because of the staff and, you know, the doctors that had reassured me that everything would be okay.
In that team approach, I think we had at least 3 medical specialties, respiratory, all the nursing staff involved, and, you know, like I say, at least a dozen people there just for a patient and her new baby.
Maya is 15 months old. We just had our first birthday party in January. Originally, my plans have been to go into the teaching program and become a teacher. But just seeing the nursing staff do what they do on a daily basis, I have changed my whole outlook on my career path, and it kind of inspired me to try to be a nurse, and I would love to have that opportunity to do that for somebody else.
Some hospitals specialize in pediatric care and women's care like Kapiolani, and we're the only one in the state who does that. There are hospitals, for example, that specialize in orthopedic problems, in psychiatric problems, in problems associated with people who are aging or in cardiac problems. But our unique abilities are dedicated to taking care of women and children.
So one of the wonderful things about Kapiolani Medical Center is it provides a wonderful environment for routine newborn deliveries. But as a neonatologist, we all know that routine deliveries can, on occasion, become high-risk deliveries. The availability of our rapid response team becomes very important. Being available 24 hours a day, 7 days a week provides generally a sense of comfort to the families, and to the obstetricians, and to the babies that we're always available when needed.
At Kapiolani, we are uniquely qualified to provide care for women and newborns, and we're absolutely passionate about what we do here. and we want mothers to come here and have the absolute best experience they can have. We believe this is the right choice for people to make to have a baby, and we believe it's the right place for a family to experience the birth of a new baby.
Taking care of not only the healthy babies, but the high-risk babies was a dream since 1890 when this hospital was started by Queen Kapiolani. It has been the mission of the hospital since then, and it is still the mission of the hospital, and I'm very proud to be a part of it.
To assure your baby receives the very best newborn care, please complete the Kapiolani pre-registration form, which was included with this DVD. Or you may pre-register online at www.kapiolani.org. You can also call us at 983-8260 to pre-register over the phone. We invite you to take a tour of Kapiolani's Family Birth Center by calling 535-7000. Or request your free tour online at www.kapiolani.org.